We'll quickly talk about the classification of cardiac investigations. All right. So, cardiac investigations is more of like, okay, a patient comes to the clinic. I know that yeah, they have a problem in this and in the CVS. Okay. So there are some things that you might just want to do to confirm that okay, um this cardiac what problem actually exists. Okay, so those are the word investigations in the medical world. So in trying to investigate, you can be investigating for disease conditions like maybe coronary artery disease, maybe how will I put it, maybe pulmonary edema, maybe pleural effusion, anything okay that is affecting the heart. Okay, you can investigate for it. All right, and this is just an overall video, so we just stated what the classifications. All right, I'll pick the imaging test, do a video on it, laboratory test, do a video on it, histological test, do a video on it. So for the cardiac investigations, it may be classified as follows. You have imaging tests. Imaging tests like what? CT scan, PET scan, MRI scan, chest x-rays, and the rest. Okay. Then laboratory tests, you could have things coming in like what? Yeah, they could be doing a blood test, complete blood count. Then they could be doing a test for cardiac markers. All right. You could even be doing tests for some liver enzymes and all this stuff. Okay. You do tests mostly for all those enzymes to see if they are elevated or below. Do you understand? I'll be talking in depth on this when we do videos on each of this. Then for histological tests, yeah, you could like for histological tests related to the cardiac. Probably they took like a biopsy of the heart. Okay, they took like a biopsy of the heart, then they sent it to the histology lab so that they could check if there's what any disease condition that is underlying there. Okay, so that's just much about the cardiac investigations. You could see this one is the what? Electrocardiogram. Okay, this one is an imaging procedure. This one is basically what? Coronary angiography. Okay, where you are trying to like visualize what the coronary artery and all the stuff, because it's the coronary artery, the left and right, that supplies the heart. Then this one you're using a probe, and a probe is used in what? Ultrasound. I didn't even mention ultrasound, which is so much important. All right, so these are the classifications of what? Cardiac investigations that can be done to confirm that the problem with the heart actually exists. Catch me up when I do in detailed videos on each one of them.